If you're a man over 50 who's getting up 2, 3, maybe 4 times a night to pee, or if you're standing at the urinal waiting for what feels like forever for things to get started, I need you to listen to this. What if I told you that eating just one specific nut every day could reduce your prostate enlargement and get you sleeping through the night again? I'm Dr. Sofia Carter, and I've been a urologist for over a decade. I've seen thousands of men struggle with enlarged prostates. And while medications work, they come with side effects that most guys hate. Today, I'm going to show you which nuts have been proven to reduce prostate size naturally, how much to eat, and why they work better than many supplements costing 10 times more. Let's talk about what's actually happening in there. Your prostate starts out about the size of a walnut when you're young. By 50, it might be the size of a lemon. By 70, we're talking orange territory for some guys. This isn't cancer. It's called benign prostatic hyperplasia, or BPH. And it affects about half of men by age 60 and 90% by age 85. Here's the problem. Your prostate wraps around your urethra like a donut around a straw. When it enlarges, it squeezes that straw. Imagine trying to drink a thick milkshake through a coffee stirrer. That's what you're dealing with. No wonder it takes forever to pee, and you never feel like you've emptied completely. But why does it enlarge? 2 main culprits: DHT and inflammation. DHT is a super potent form of testosterone that accumulates in the prostate as you age. Your body converts regular testosterone to DHT using an enzyme called 5-alpha reductase. More DHT equals more prostate growth. The second culprit is inflammation. Years of diet, stress, and just living create chronic inflammation in your prostate. Inflamed tissue swells, making the problem worse. Add in the fact that zinc levels drop as you age, and your prostate needs more zinc than almost any other organ, and you've got a perfect storm for enlargement. The medications doctors prescribe either block that enzyme that makes DHT or relax the muscles around the prostate. They work, but guys complain about sexual side effects, dizziness, and feeling off. What if you could get similar benefits from something as simple as nuts? Let's start with the heavy hitter, Brazil nuts. These aren't just any nut. They're basically a prostate medication disguised as food. One single Brazil nut contains about 90 to 100 micrograms of selenium, which is almost twice your daily requirement. And selenium is absolutely crucial for prostate health. Here's what selenium does. It's a powerful antioxidant that specifically concentrates in prostate tissue. Studies have shown that men with higher selenium levels have significantly lower rates of prostate enlargement and prostate cancer. One major study found that selenium supplementation reduced prostate cancer risk by 63% in men with low baseline levels. But for BPH specifically, selenium reduces inflammation in the prostate and helps regulate cell growth. It also supports the immune system's ability to clear out damaged cells before they cause problems. Think of selenium as the cleanup crew for your prostate. The key with Brazil nuts is moderation. 1 to 2 nuts per day maximum. More isn't better with selenium. Too much can actually cause problems like hair loss and nail brittle. The sweet spot is 1 large or 2 small Brazil nuts daily. Buy organic Brazil nuts from Brazil or Bolivia if possible. They have the highest selenium content due to soil conditions. Keep them in the freezer to prevent rancidity, as they're high in oils that go bad quickly. The investment is about $15 a month for premium quality nuts that could save you from surgery. Next up, pumpkin seeds. And these might be even more important than Brazil nuts for some men. Your prostate contains more zinc than almost any other part of your body. It needs zinc to function properly and regulate growth. When zinc levels drop, the prostate enlarges. A 4 cup of pumpkin seeds contains about 2.5 mmol of zinc, which is significant when you consider men need 11 mmol daily and most don't get enough. But pumpkin seeds do more than just provide zinc. They contain compounds called phytosterols that specifically block DHT production in the prostate. A German study followed men with BPH who took pumpkin seed oil daily. After 3 months, their international prostate symptom scores improved by 41%. They were peeing stronger, emptying better, and getting up less at night. That's comparable to some medications. Eat a handful, about 1 Oz or 2 tablespoons of raw pumpkin seeds daily. You can roast them lightly for better flavor, but raw preserves more nutrients. Some guys grind them up and add them to smoothies or yogurt. The key is consistency every single day, not just when you remember. Pro tip, buy them in bulk and keep them in the fridge. They're way cheaper than the packaged ones and fresher too. About $10 gets you a month's supply of organic pumpkin seeds. Walnuts are fascinating for prostate health because they work through multiple mechanisms. First, they're loaded with omega-3 fatty acids, specifically alpha-lolenic acid, which reduces inflammation throughout your body, including your prostate. But here's what's really interesting. Walnuts contain gamma-tocopherol, a form of vitamin E that's particularly effective at fighting prostate cancer cells. A study from UC Davis found that mice fed walnuts had significantly smaller prostate tumors and slower growth rates. For BPH, the anti-inflammatory effects are what matter most. Chronic inflammation makes your prostate swell beyond just the tissue growth. By reducing inflammation, walnuts can provide relief even if they don't shrink the actual gland size. Many men report easier urination within weeks of adding walnuts to their diet. Eat 5 to 7 whole walnuts daily, preferably raw or lightly toasted. Don't buy pre-chopped walnuts. They oxidize quickly and lose their beneficial oils. Whole walnuts in the shell last longest, but shelled ones are fine if you eat them within a few weeks. The bonus with walnuts is they improve cardiovascular health too. Your prostate and heart health are connected. What's good for one is usually good for the other. Plus, better circulation means better sexual function, which BPH medications often impair. Almonds might not be the first nut you think of for prostate health, but they're incredibly effective at reducing inflammation. They're rich in vitamin E, magnesium, and healthy fats that all work together to calm inflammatory processes in your body. What makes almonds special is their skin. Those brown skins contain flavonoids that work synergistically with vitamin E to reduce oxidative stress. One study found that eating almonds with the skin on doubled the antioxidant effect compared to blanched almonds. For prostate health, the magnesium in almonds is particularly important. Magnesium helps regulate calcium metabolism, and excess calcium in the prostate can contribute to enlargement and inflammation. 20 almonds provide about 80 milligrams of magnesium, helping maintain the right mineral balance. Eat 20 to 23 almonds daily, which is about 1 ounce. Always choose raw or dry roasted without added oils. Those honey roasted or flavored almonds are candy, not medicine. Keep the skin on for maximum benefit. Almonds also help regulate blood sugar, which matters because diabetes and metabolic syndrome significantly increase BPH risk. By improving insulin sensitivity, almonds provide indirect prostate protection. Cashews are often overlooked for prostate health, but they shouldn't be. They're rich in zinc, magnesium, and most importantly, anacardic acid, a compound unique to cashews that has powerful anti-inflammatory effects. Research from Brazil, where cashews are native, found that anacardic acid inhibits the enzyme that produces prostaglandins, inflammatory compounds that contribute to prostate swelling. It's like nature's ibuprofen, but specifically concentrated in prostate tissue. Cashews also contain betaol, the same compound that's in many prostate supplements. Beta-sitosterol improves urinary flow and reduces the amount of urine left in your bladder after peeing. Studies show it can improve symptom scores by 35% in 3 months. Eat about 18 cashews daily, which provides roughly 1 ounce. Buy raw cashews when possible. The roasting process can destroy some beneficial compounds. If you prefer roasted, look for dry roasted without added oils. The creamy texture of cashews makes them Perfect for making nut milk or cream, which some men find easier to consume daily than whole nuts. Homemade cashew milk with no additives is actually a prostate-healthy beverage. Pecans don't get much attention for prostate health, but they should. They have the highest antioxidant content of any tree nut, even higher than walnuts. These antioxidants, particularly ellagic acid, have been shown to inhibit prostate cancer cell growth. For BPH, pecans work by reducing oxidative stress in prostate tissue. Oxidative stress accelerates cellular aging and contributes to enlargement. The gamma in pecans, that same form of vitamin E found in walnuts, specifically accumulates in prostate tissue. Pecans also contain plant sterols that compete with cholesterol for absorption, potentially reducing the amount of cholesterol available for conversion to hormones that fuel prostate growth. It's an indirect but meaningful effect. Eat about 15 pecan halves daily. Buy them in shells if possible. They last much longer, and you're more likely to eat them mindfully rather than overdoing it. Pecans are higher in calories than some other nuts, so portion control matters. You don't need to eat all these nuts every day. In fact, that would be too many calories and potentially too much selenium. Here's my recommended protocol. Daily non-negotiables. 1 Brazil nut for selenium and 1 oz of pumpkin seeds for zinc and phytosterols. This is your foundation. Rotate the others. Monday, Wednesday, Friday, add walnuts. Tuesday, Thursday, add almonds. Weekends, enjoy cashews or pecans. This variety ensures you're getting different beneficial compounds without overdoing any single nut. Timing matters slightly. Eating nuts with meals improves absorption of fat-soluble vitamins. Many men find that having their Brazil nut with breakfast and pumpkin seeds as an afternoon snack works well. If you can only choose 2, go with Brazil nuts and pumpkin seeds. These 2 alone can make a significant difference in prostate symptoms. Studies show improvements beginning around week 6 to 8, with maximum benefits by month 3. While nuts are powerful, combining them with other lifestyle changes amplifies results. Stay hydrated, but time it right. Drink most of your water before 6 p.m. to reduce nighttime trips. Dehydration makes urine more concentrated and irritating to the prostate. Limit coffee and alcohol, especially in the evening. Both irritate the bladder and prostate, worsening symptoms. If you drink coffee, have it before noon. Add lycopene-rich foods like cooked tomatoes. Lycopene specifically accumulates in prostate tissue and has protective effects. A small glass of low-sodium tomato juice daily can help. Exercise regularly, especially walking. Sitting compresses the prostate and worsens symptoms. Even 20 minutes of walking daily improves pelvic circulation. Manage stress. Chronic stress tightens pelvic muscles and worsens BPH symptoms. The magnesium in nuts helps, but active stress management multiplies the benefits. I need to be clear. While nuts can significantly improve BPH symptoms and may even reduce prostate size, they're not a replacement for medical care in all cases. If you have severe symptoms, blood in your urine, or a complete inability to urinate, see a urologist immediately. That said, for mild to moderate BPH, this nutritional approach is worth trying before medications. Many of my patients have avoided or delayed medication by committing to dietary changes. Even those on medication often find they can reduce their dose when adding therapeutic nuts. The beauty of this approach is there are no side effects beyond possible weight gain if you overdo portions. Compare that to medications that can cause erectile dysfunction, retrograde ejaculation, or dizziness, and nuts start looking pretty attractive. Get your PSA checked before starting and again after 3 months. This helps track improvement objectively. Some men see PSA reductions of 20 to 30% just from dietary changes. Here's what I want you to do. Commit to 90 days. Every morning, 1 Brazil nut. Every afternoon, an ounce of pumpkin seeds. Rotate other nuts as described. Track your symptoms. How many times you get up at night. How strong your stream is. How complete emptying feels. Keep a simple journal. Rate your symptoms 1 to 10 daily. Most men see a 2 to 3 point improvement by day 90. That might not sound like much, but it's the difference between getting up once versus 3 times nightly. Remember, your prostate took decades to enlarge. It won't shrink overnight. But with consistent nutrition, you can reduce inflammation, block excessive growth, and potentially avoid more invasive treatments. Your prostate health affects everything: your sleep, your confidence, your relationships. Taking control through something as simple as eating the right nuts daily puts power back in your hands. No prescriptions, no side effects, just food as medicine, the way nature intended. If this information helped you, share it with other men who might benefit. Start tomorrow with one Brazil nut and see where you are in 3 months.